This is Riley. He's an 83-pound, 11-year-old intact male golden retriever. He's here to have this mass removed. The blood supply to the mass is no longer present, so histopath would be futile to determine what the mass is. It's highly unlikely that an 11-year-old golden retriever would undergo chemo and radiation for something like this at this time if it is malignant. As far as staging it, well, that's always a possibility. But for right now, my only concern is getting this mass that he has snagged on something and get it off and do whatever it takes to get that off of there. I've clipped it. I need to clip a little more on it, but after I've examined that, I believe I can remove that without removing the fourth digit. I need to re-scrub it again and see what can be done. I'm very, very pleased with this. There's absolutely no tension on these sutures. No stretch, none of that, where they will bust open. Any abnormal tissue was removed. And I'm just very pleased with that. That really looks good. Let it focus. This camera's been acting kind of goofy lately. Alright, pulse ox, heart rate, respiratory rate, all of that's been totally normal through the owner wants me to address this ear hematoma. It's been here for at least 3 or 4 months. Okay. Let me center that. Let me shave it and we'll look at it again. Here is the ear hematoma. I've got to scrub it maybe one more time and clip it just a little bit more. You'll notice that is the hematoma right there. What is recommended past 40 years that I know of is to make an incision on the inside along the middle of the hematoma and then scoop all the clot and the hematoma out and then tack down both sides like a quilt. And then of course he's got to wear the head shield anyway. So the ear's been clean, but I do need to scrub for surgery now. Alright, if you'll notice, the incision goes from right there all the way to right there. At the very end of the ear, it has already solidified, hardened. The cartilage is permanently twisted, mangled. That cannot be corrected. Yeah, I could cut that off, but leave it. To cut it off would be unattractive. Just leave it, and once the hair grows back on the ear should look fine. Okay, these are absorbable sutures, and they will fall out. Triple antibiotic ointment only. Even right here on the paw, triple antibiotic ointment. Never, never hydrogen peroxide, and never anything with cortisone. Delays healing, and the hydrogen peroxide destroys suture, and then bad things happen. I'm going to put a size 25 head shield on. He'll be going home on 1,000 milligrams of cephalexin morning and evening with food, and about 85 milligrams of carprofen morning and evening with food. And I'd like for him to stay out of dirt and mud and water for about 12 days. We'll take these sutures out of here in 12 days. These, they'll fall out. Okay, here's Riley. Head shields on. Very, very secure. No, I will not use his collar. I don't trust him. I like these homemade gorilla collars that I make. You got to make sure you can't pull this over his head. The ear looks real good. The anesthesia's turned off. He's on nothing but oxygen. As soon as he gets light enough, I'm going to transport him to his recovery pen. All right, here's Riley. There you go, boy. Can you feel that there? Red tongue's always good. Blowing his eyes. Okay, he's doing good. Waking up good. Nice and comfy. Got plenty of bedding. He's long. All right.